You are watching Prime Morning. My name is Roslyn Fairley. It's time for us to talk about health-related issues. And of course, today we are talking about sickle cell. But before then, let me wish this woman a happy birthday. And she ought to be celebrated, of course, because her family loves her so much. And her name is Ya Sampene. Yeah, Sampene, you are in Brekume. Happy birthday to you. This is coming from Abena, Ghana. She says she loves you so much from the bottom of her heart. May this day be a blessing. May it be a new beginning to greater heights. Enjoy your day. Yeah, Sampene. I hope I got your name correct. Okay, so like I said earlier, we are talking about sickle cell, and we have the doctor right here who will definitely guide us with this conversation for us to have a clearer understanding. We'll activate the phone line for you at home to join the conversation later. And so if you have any questions with regards to sickle cell, do call us and join the conversation. And my doctor for today is Dr. Marian Georgia Kwanzaa. She is a medical officer. Welcome, Doc.
Thank you, Roslyn.
How are you today?
Fine, thank you.
Great.
How are you too?
I'm fine, thank you. And you actually talk all about sickle cell. So
yes.
Today, when we talk about sickle cell, you are the best person to help us with this conversation. Sure. Now, most people know sickle cell is sickle cell, but they don't know what really sickle cell is. So break it down for us, and then we can delve deeper into the conversation.
Okay, all right. Thank you, Roslyn. So I'm here today. I'm a volunteer from Sickle Life. We are a health advocacy group for sickle cell disease. So basically, when we talk about sickle cell, it's an inherited disease. When we say inherited, we mean genetic. You get it from your parents. So it's a disorder of the red blood cells due to a change in a certain protein in your cell called the hemoglobin. So for us, if your hemoglobin is unchanged, we say you are A, hemoglobin A. However, if there's a change in your hemoglobin such that yours is different from the A, we could have hemoglobin S, we could have hemoglobin C, and
so
others.
So it's the S and C's that
Good.
are...
So for sickle cell, basically you have sickle cell when you have the S and another hemoglobin which is not A. Good. So that's why we say you have the sickle cell disease. Right. But the main emphasis is genetic. And it's a chronic condition. It's just like having hypertension, diabetes. But people always think that it's only a bone pain that's sickle cell or a particular symptom that's sickle cell. No. It's something that is always ongoing, like the way we have hypertensives, diabetes. Right.
Let's talk about the blood groups. We have the A.
Yes, so we have blood groups and then we have genotype. So the blood groups, we have the A, we have B, we have AB, and then we have O.
Okay.
So those are the blood groups.
That's the blood group. Then we come to the genotype.
The genotype. So for the genotypes, we have AA, we have AS, we have AC, we even have so the SS is the sickle cell, but the special name is sickle cell anemia.
Okay.
So that's the SS. Then we have SC. Then we have others.
Which one is the SC?
So the SC, we have another type of hemoglobin, that's hemoglobin C. Okay. It's just also a different variation, just like the way we have the S. So if you have S with the C, because the C is not an A, if it's paired with the S, you are still termed as a sickle cell.
Which is more dangerous? Is it the SS or the SC? Okay,
so in terms of severity, I wouldn't use dangerous, I'll use severity. Right. Yes. So in terms of severity, SS is the most severe.
Okay.
Yes, so SS is the most
severe. So the
severe.
SC is a bit manageable?
SC is relatively milder than the SS, but each one has its own. For the SCs, they usually have eye problems and a lot of hip joints issues. But they have tiredness. As for the tiredness, it runs through. Okay. But for the SC, they just have relatively a higher amount of blood levels than the SS. Okay. Yes. So basically, each one has its own special components. Yeah.
Now, if you should marry, if someone who has AA marries somebody who has SC, is it possible the person can have AC?
Yes, it's possible the person can have AC because you can pick an A from the first, let's say the man is AA, the woman is SC. So the A can come from the man, can be paired with the S from the woman, or the A from the man can be paired with the C from the woman. So you can have.
Now, when you have AC, is it also severe? Is it also sickle cell?
So AC is just a trait for another disease because there's not an S component. That one is not sickle cell.
But it's still disease.
Oh, yeah. So that one is just a trait. So just like the way we have AS, we also have AC.
Oh, right.
So that one is just a trait.
Okay.
But that is not under sickle cell.
Right.
Yeah.
We've heard a lot about sickle cell. Again, like I said, you know, with churches, you know, where they tell you check your genotype before you marry, and there's AS, if you marry, you have SS and all of that. In recent times, also, study has proven that, you know, you can drain the blood and replace the blood. How true is this?
Okay, so basically for I think what is behind that teaching is we have something called bone marrow transplant.
Okay.
Okay, so the bone marrow transplant is basically if somebody has a sickle cell disease, you would want to change what is producing the sickle cell. That is the bone marrow. So we look at that as a cure for sickle cell disease, but it is very expensive. And for that one, the aim is that if I'm replacing that bone marrow in my body with somebody who doesn't have the sickle cell disease, then subsequently the cells that will be produced will not have the sickle cell.
Right.
But that is not a feasible option now because though it's effective, it's very expensive. There are so many other things you have to look at. Yes. Okay. But you always have to make sure that the person is optimized, else the person receiving that bone marrow the body can reject it. There have to be so many investigations done to make sure that it is the bone marrow being given matches with the person's own body. So there are a lot of risks and complications associated with the bone marrow.
Is there any age limit for people who get to the bone marrow?
No. There's no age limit. There's no age limit.
So anybody
anybody can go for it. But because of how expensive it is, it's not usually affordable for everybody to just
ordinary man. You have to be of a certain class, or probably contribution have to be made before
it depends on your financial.
Right. Now let's talk about the symptoms of sickle cell.
Okay. So right from the babies, okay, usually around 4 to 6 months of age, you realize that babies with sickle cell, they usually have swelling of their toes or their fingers. Yes. So that is usually around 4 to 6 months. That's when those ones come. But there are other presentations. For some people, theirs is basically the bone pain. That is the most common symptom that a lot of us know, the bone pain. For others too, they have theirs where they have issues with breathing, coughing, fever, and all that. For some people, they end up, their cells break down. So their urine becomes very dark and black like Coca-Cola, with their eyes also becoming yellow. For other people too, their tummy, we have our liver and our spleen, so they feel that their tummy is enlarging. Good. So all those are symptoms and signs of the person being in a sickle cell crisis.
Are there any triggers?
So the trigger for sickle cell is a person-to-person factor. So for some people, their triggers may be different from others. But we have risk factors. So the risk factors, we have infections. Certain infections can just push somebody to get their crisis. And then, so if you are dehydrated, if you are not taking in a lot of water, we always advocate that for sickle cell, you have to be taking in a lot of water. There are some people, so it's just because of stress.
What's the quantity that you need to take in a day? Okay,
so the recommended quantity is at least 3 liters a day. That's about 6 sachet waters or bottles, like a 500 ml, so at least 3 liters a day.
And it can keep the pain away?
Yeah, so the idea or concept is you are hydrating yourself. So you're not allowing the cells to get together or clump together. You're allowing them to move freely in the body. So we always advocate that hydration is key. Then we also have, for some people, it's just stress, either physical stress or emotional stress. It all can trigger the sickle cell disease.
Oh, wow. Yeah. Now, talking about the stress aspect, I mean, it's part of our lives. You will be stressed on daily basis. So when it's triggered, what can a person do to calm the pain? Okay, so for the first age, assuming we are here now, somebody has an acute episode. So you can, for some people, they are basically on their own pain medications, probably from the hospital. So the person can start taking the pain medications, start taking in a lot of water. And then also you see if there are any factors in the environment that is affecting the person. For example, if the room is very cold,
it can predispose the person to get in a crisis. So when it happens like that, I can decide, okay, let me turn the AC off for the person. If the room is very hot, you'd want the place to be ventilated, and then you can take the person to the hospital for.
Oh, ventilation helps.
Oh, yes, because basically you want the cells to get a lot of oxygen as much as possible. So in a place where the person has a crisis, the person is in a closed room, at least opening the windows for aeration to be there, for the person to get enough oxygen at least to take in also.
Let's talk about the things they can do to prevent, you know, the triggers from happening, to prevent them getting into crisis. Okay,
so we have primary prevention and then we have secondary prevention. For the primary prevention, that's when you actually take the initiative to check your genotype, to know your status and all that. But for prevention of the crisis in somebody who already has sickle cell, we always advocate that the person knows his or her triggers. You always stay hydrated. You avoid the stressful conditions peculiar to you, and also get enough rest. And there are people too that are always seen at the sickle cell clinic. So the review dates, you go for your reviews, you take your medications. We usually put them on folic acid, penicillin V for the children and all that. So if they are compliant with their medications and do these basic lifestyle medications, it helps put the crisis at.
Can they exercise, like run long distance, you know, do weightlifting and all?
Okay, so for exercise, well, you can exercise, but with caution. Yes, because as you exercise, you will sweat. As you are sweating, it means that you are losing water. So it means that it always has to be alongside with you keeping yourself hydrated. So everything has to be in moderation, so that you're not losing so much water. At least whatever you are losing, you are replacing it. Yes, so that's the concept.
Right. Let me activate the phone lines. I know people at home want to join the conversation. If you have any questions with regards to sickle cell, please do call us and join the conversation. I don't know what your question is, but Doc is here to answer that question. But, you know, so basically, if you have sickle cell, you need to make sure that you don't sweat.
Okay, so you will sweat. You're a human being, definitely.
Yeah, but you need to prevent excessive sweating,
yes,
right?
so you always just have to make sure that you are being hydrated.
That's it.
That's it. You have to make sure that you are constantly taking in lots of fluids. And there's one thing too that we also have to note: the complications of sickle cell disease. That is the effects of sickle cell disease. So from our head to our toe, I'll start from the brain. We have acute and chronic. So acute is something that is happening there and then. And then chronic is the long-standing effect. So when we take our brain, sickle cell can cause stroke. Okay, it can cause stroke. But the long-term effect is that with time, the person may have reduced brain function because of this constant, the brain being affected and all that. Then as we are coming down, we come to the eyes. So for the eyes, they can have eye problems. In fact, some people are even diagnosed of sickle cell disease at the eye clinic, because probably they were just going for a checkup, and then and then they requested for the test to be done, and then they found out that it's actually due to the sickle cell. We have something called sickle cell disease retinopathy. So
can it lead to blindness?
Oh yes, it can. So all those ones are also effects. When it comes to the chest, the person can have breathing issues and all that with the chest. Long-standing, there will be hypertension. We have some hypertensions that are in the lungs called pulmonary hypertension. So long-standing, it can also cause that. It can cause kidney issues, long-term, spleen issues, the bone pain, your blood levels will go down.
When long-term is how many years?
So long-term...
Because you're born with it.
Yes, you are born with it. And the reason why we say it's chronic is that a chronic disease is basically a disease that is with you for at least a year or more, where you always require constant medical attention. And for sickle cell, you would require the constant medical attention, yes. So we always advocate that you know these things so that when you are seeing these effects at home, you don't sit down and wait. One of the problems we have is people present to the hospital with late complications. If they had come earlier...
Because they don't know.
Because they don't know, yes. Because they attribute it to other factors. Oh, it's a case, it's something I ate.
But don't they check the blood type when the baby is born, the genotype?
So now we have newborn screens for genotype. Right. Yes. At first, even for our pregnant women, for some of them, they just get to know their blood group and their genotype during antenatal care. But ideally, it's something that we should be doing. So you should get to know your blood group and then your genotype. People just know their blood group and then think that is their genotype, but they are two different things. So even if you know your blood group, you should know your genotype.
Right. I have a first call. Good morning.
Good morning.
Yes. Name again, please. You're calling from.
My name is Edwin Aqua, calling from Transplants.
All right, Edwin. Let's hear from you.
Okay, so my question is: we are told that sickle cell patients, we are not supposed to during the bone marrow transplant. It's not 100% safe for us to survive the transplant. So most of the times we are told to manage it due to this new medication that has come up, hydroxyurea. So we take it and it reduces the amount of pain we have in a year. So let's say during the year I can be having crisis frequently, but as soon as I'm being put in on the medication, the crisis reduces. Yes, the amount of pain I'll be experiencing in a year, it reduces. So let's say in about 6 months, I won't be experiencing crisis. Or in about 4 months or 5 months.
But is this affordable?
Crisis. So, per what I was just reading on headlines about the bone marrow transplant, for me, the bone marrow transplant, for me, I don't think it's safe for sickle cell patients to go for that.
Okay.
Because per my information that I've heard of it, it's not 100% safe. Because you might go for bone marrow transplant, the blood may work all right and everything. At the end, you might not adapt to the new blood that you have, and then it might cause complications to you.
Okay.
Yes. So
are you a sickle cell patient yourself, Edwin?
Yes, please. I'm a sickle cell patient myself.
Okay. All right.
And I've been going for checkup, and I'm on the hydroxyurea, which is a very good medication.
Okay.
And I would like all people out there to go for it too.
How old are you?
I'm 22 years old.
Okay. All right. Okay. Thank you so much for calling, Edwin.
Okay.
Yes.
So he even just emphasized on the point I was making that, so because it's a risky surgery, and then even before you are prepped for the surgery, you have to be given medications to suppress your immune system such that your body doesn't reject what you are given. So that's one of the reasons why
you don't get the effects immediately?
So surgery is something that you can get effects either during the surgery, early after the surgery, or later after the surgery. Yes.
Wow. Somebody sent a message saying that, please, my girlfriend is SS and I'm AA. Is it advisable to go on with her? And can you please throw more light on the bone transplant?
Okay. So he is AA and then the girlfriend is SS.
Okay. Yes.
So even before I come to his question, at first we used to admit that assuming two people are AS, you don't get married and all that. But for now, what we are doing is we are letting you know your options. Then you would make your own informed decision. So that at least when you're signing up for it,
you can have an AS or SS.
Yeah, so for him that he is A and then the girlfriend is SS, it means that the parents, all their children will be A's, because they will take the A from him, the girlfriend S, so the children will be carriers.
Okay.
Just the carrier of the S. But now what we advocate is that
experience the pain in their...
So AS, they are just carriers.
Okay.
So they don't have symptoms.
Right.
Yes,
but there's a possibility they can get... Is it possible?
No,
Not at all.
No.
Okay, right.
So for the AS, what we usually advocate is there are some people that will decide that, okay, I'll get married, but we will not have children. Some people will decide that we'll get married, but we'll go for adoption.
Oh, right.
Others too decide that they'll go for IVF is a lab way of just getting pregnant. So that one you select the gene. So IVF with gene selection. Okay. And then there are some people, they really love their partner, so they'll go ahead. But before you go ahead, you have to know that you have the emotional support, the financial support, the social support.
It takes a lot
to take care of the child.
Right. Let me answer this call. Hello. Good morning, Michael.
Yeah, hello. Good morning.
Yes. How are you?
I'm fine.
Great. Let's hear from you, Michael.
I'd like to ask the doctor, please, about hydroxyurea. When I take it, I get frequent crisis pain. But once I don't normally get a pain. I want to ask why it's like that, please.
Okay, Michael, don't cut the call yet because Doc might have a question for you, Doc.
Okay. Michael, is it only when you take the medication, or I just want to know how the symptoms started before you started the hydroxyurea?
Please, with the hydroxyurea, normally check up the sickle cell clinic. That's where I normally go for my frequency.
Okay.
But within a I barely have crisis. But when I started taking the hydroxyurea, the crisis pain became constant.
Okay.
So I had to stop taking it. As I speak to you, I don't even take it. I just take my zinc over it.
Oh.
That's all I do.
Okay. So, Mike, I wouldn't advise that you stop taking it, but what we can do is, usually when you're on hydroxyurea, we still carry out some lab tests even as you're on the medication, because we want to know if your blood counts are within normal range or toxic ranges. So you can just report to your sickle cell clinic. We will do the blood checks. If we have to adjust the dosage of the medication for you, then we will do that. But I wouldn't recommend that you totally stop the hydroxyurea. So kindly visit your sickle cell clinic and we'll review the dosage and any other thing that we have to attend to for you.
Okay, Doc. One last question, please. Are you at Kolebu yourself, or
no? I am not at Kolebu, but I found out the Sickle Life, Dr. Enam Bankas. She is at Kolebu with the sickle cell unit.
Okay.
Yes. So we are Sickle Life. Once you get there, she'll be there too. Okay.
All right.
We'll try and get the number out so people can call you. Okay.
Sure.
All right. I have a lot of questions here. I'm going to try as much as possible to read as many as possible. Says, hello, I'm watching the program. Please, is there a possibility of someone with blood group O positive and a mother of AA to give birth to a sickle cell baby? It looks like people have the confusion of the blood group and the genotype.
Okay.
So please explain.
Okay. So please, the blood group is different from the genotypes. The blood group is basically something that is on your cell that we see from the lab. So that's why we know if, okay, maybe you are A positive, B positive, O positive. But for the genotype, we are referring to how your hemoglobin is in the cell.
Okay.
So it's not just enough to know what is on your cell, but you go the extra mile to know what is in the cell. That is the hemoglobin, the genotype of the hemoglobin you have. So you could be O positive and you could be SS. You could be A positive and you could be AS. They are just two different parameters.
Okay,
yes.
Okay. Now, this one says, good morning. My name is Akosia from Mampong. I am SC. I'm an SC patient, but I don't have crisis often and I don't know if I'm okay. Because I have seen lots of people taking medication here and there, but I'm not under any medication yet. I barely experience crisis. Please don't call my WhatsApp number. Okay, I can. It can take me 1 to 2 years before I experience crisis. Is this normal?
Okay. Yeah, so that is perfectly normal. It means for her, at least, she's doing something that probably she doesn't know is helping her.
Yeah.
Yes.
Yes.
So it means that hers is very well controlled. So I'll just recommend that whatever she's doing, staying hydrated, any other thing, it's normal. It doesn't mean there's something wrong with her. It doesn't mean you should have a crisis at all costs before you know that, okay, yes, you actually do have.
Right. I have another caller. Hello, good morning.
Good morning.
Hi, what's your name and where are you calling us from, please?
Stephen from Bolga.
Stephen, okay, let's hear from you, Stephen.
Yes, I want to ask the doctor a question. Do you have, I heard her mention sickle cell clinic. Yes, sickle cell clinic. Do you have sickle cell clinics all over the country?
Okay, so it depends on the hospital.
Yes, please. I want to add something.
Okay.
I've realized that a lot of the hospitals, or should I say some of the hospitals, actually do not have people who are specialized in that particular area, sickle cell. Excuse me to say, I'm not trying to be disrespectful to health persons, but my nephew died 2 years ago from sickle cell. He started with some very unusual symptoms. Whenever he used to have a crisis, he never had that type of symptoms. It started like malaria, but the mother suspected it, rushed him to the hospital, and within a week, the boy died. So I would like to say that, please, maybe if you can try to talk to your people so that we have sickle cell centers everywhere in the country. Or they should try to give the health persons some refresher courses so that they know how to handle such cases. When they know that they do not know much about sickle cell, they are not very good in that particular area, they quickly refer the person. Because the boy has died, and well, thank you very much.
It's quite sad. Thank you so much for calling. This is sad, you know. Yeah, and really, like you were saying, a lot of people don't even know that they are, you know, either SC or SS or, you know, no, they don't know. They're just walking around. Anyway, this one reads, please, when someone is sickling positive, what does it mean?
Okay. So sickling positive, we have a test. We have different levels of the tests that we do for sickle cell. So we have a sickling test. So the sickling test, it will just tell you whether you have an S or not. So that is the sickling test.
Okay.
So if your sickling test is positive, you have to do another test called the HB electrophoresis. So that is what will tell you whether the S you have is an S paired with an A or an S paired with a C.
Okay.
So that is, so if you are sickling positive, it means that you have to find out the exact genotype because it's just telling you that you have the S.
Okay. Yeah. And this one says, what does a VOC in SCD patients mean? I'm Malvina from Agunan Kwanta. Okay,
Malvina. So VOC is vaso-occlusive crisis, and the SCD is sickle cell disease. So the vaso-occlusive crisis, it means that there is an occlusion in your cell, in your vessel.
Okay.
So the vessel is more like related to the vessel, and then the occlusive is the sickle cell blocking the vessel. So vaso-occlusive crisis. So that is what will cause the bone pain because there's not blood supply to that particular place of the body. You get the bone pain and all that. But aside the cells itself, it also affects your vessels. There's always, even if a sickle cell patient is fine, always there is something we call inflammation going on in the body. So the body is always in a ready to attack mode if it gets in anything that it doesn't want.
Right.
So we always look at the vessels and the cells.
Okay, I have a call. Let me answer this call before I come back to the messages. Hello, good morning.
Good morning.
Yes, please. What's your name, my darling?
Your friend
Yo. Let's hear you.
My bad job for 15 years. Sickle cell need the awareness and that. It's me the same. You cook with me when you are. You decide a no man say reality.
Okay, all right. Doc.
Man pacho medasio enti ubana wa sickle cell na akoma de na betumi aba ne say no nso ka ho because sickle cell no eba ne sa na etumi ha ahrawa ne nyina nso te eba ne sa na ne home ne ayi ne nyina problem eba ho nti me pacho hu ne sa no na nya de ayede tena fie why nti se hu ne sa na wo de na ko hospital bi eben wo de ka ho nyina bia ne ne ubedi ho nkomo wo ho. But once I want to happen, now they not go hospital again.
My question about continuity. It's me money more area and a told that man to be okra with me.
In the mammy pacho, menses no, sickle cell ankasa no, moja no ekofom. Swim, But the menses name ma and no nye sickle cell related. E bet me aba ne say bibi kan ho a ye nye hu ye. But sickle cell nankasa no omojare. Nti sa no ma mienu na esun we bia ne se ne esifa.
Thank you so much for calling. Let me go back to the messages. I have so many messages. It's not it's okay. So my blood group is B and my girlfriend too is B. Is it good for marriage?
So I think people are still confused with the phenotype. And
this one says, please, I'm having hepatitis B and I want to ask if I can be treated. Okay, we are not treating hepatitis B today. I'm sorry. Good morning, I'm Janet. Please, my blood group is AB positive, but my HB electrophoresis is AA. Please, what should I do?
Oh,
that's good.
Yes,
that's good for you. You don't have a problem at all. Okay. Good morning. I'm Esim Isaac from Bremen Asikuma. Okay. Please, my question is: do we have people with genotype AC? And can you brief me more on the genotype status, which you've been talking about?
Yeah. So we actually do have people with the genotype AC. Yeah.
Okay. Right. Okay. So this one says, I'm RG Kofi Richard. Please, how will you know that you have sickle cell?
So basically, he has to check his genotype.
Okay.
Yes, that's why we are here. We are trying to create
Just
the
make sure that you get tested.
Yeah.
Okay, I have my other caller. Hello, good morning, Emmanuel.
Hello, good morning.
Yes, how are you?
I'm doing good.
Great. Let me hear from you, Emmanuel.
Okay, I know sickle cell anemia is inherited. So I just want to ask Doc, what's the probability that a family or couples who are not having sickle cell background be inherited?
Oh, once, unless I'm not getting you right, once there's no genetic composition from your parents, there's no way you as a child you would
But
get
ASAS, can they have?
Oh yes, ASAS.
Okay.
So ASAS is either the A from, so let's say the A from the father can pair with either the A or the S from the mother, and the S from the father can pair with either the A or S from the mother.
Okay.
But the thing is, for every pregnancy, so if we take the A from the father and it's paired with the A from the mother, that's AA.
Yes.
If we take the A from the father paired with the S from the mother, that's AS. If we take the S from the father
and the S from
the mother, that is SS. So with every pregnancy, you have a 25% chance that the child will be SS.
Okay.
It doesn't mean that at all costs every AS couple will give birth to.
All right, Emmanuel, I hope you understand.
Yeah, okay.
Great,
Doc.
thank you.
Okay.
All right, this one reads, good morning. What's the best pair of genotype can I have as a partner if I'm SC? And also, also my BP always associated with sickle cell anemia.
Okay. So, so the first question was the SC. Good. So for the SC, we don't say, okay, go for this genotype or go for this genotype.
Okay.
But we just always let you be aware of your options. Good. So for the SC, it means that if you are going in for somebody who is even AS, it means that there's also the probability that you get either an SS child, an AS child, an AC child, or an SC child. So you, like what I said, you should know and discuss with the person, are you going to have kids? Are you going to go for adoption? Are you still going to have the children? Are you ready to support the children? Are you ready to cater for the cost of all the medications? Yes.
Okay.
So you have to look at all those
All right,
factors.
still the calls are coming in. Ima, you sent a message. I was about to read it, but I've seen that you've called me. I have over 59 messages.
Wow.
I have over 59 messages. Please oh my goodness. Okay, let me go on the phone. Hello, good morning.
Hello, good morning.
Yes, how are you?
Fine, thanks. But tell me, did you factually?
Yo, Fatih.
Me visa say me blood group near O positive. Possible se met me awo akwala with sickle cell.
Oh.
Okay, we need to clear this.
Yes, we need to clear this. Okay.
Why?
So let me use this example I gave over the weekend. Over the weekend, we had a health screening for St. Rose's Senior High School, also by Sickle Life, with our sister group, that's Sickle Cell Awareness Initiative, in collaboration with Novartis. So over there, I told the students that, you know, you can take a 5 Ghana CD note. So the blue color you are seeing on the 5 Ghana CD notes, that is blue. Okay, so that is your phenotype. So A, B, O, from the lab, certain things that we see on the cell will tell us your blood group. Then now, when you take that same 5 CD note, it has a special number on the note.
Right.
Yes. So that is peculiar only to that 5 CD note. So aside knowing that I'm holding a blue sheet, I also have to know that number on the sheet. So that number in human beings, that number in quotes, are the genotypes.
Right. So in a nutshell, you can be O, but your genotype can be SS.
Good.
Passion, what I say?
NC, maybe I just a mechanic tree. NC,
You can but blood genotype SS. Yes. Good. My calls are just something else this morning. This one says, good morning, please. Are there complications for a carrier and does it affect menstrual cycle with AS persons? This is coming from Barbara Mankesim.
Okay. So for sickle cell, if it's having a problem with your menstrual cycle, they are not so much related unless there is an already existing problem that sickle cell is compounding the effect.
If the person is anemic?
So if the person is anemic, it means that already the person has low blood levels.
So the person
we have to... Oh, no. The person can still menstruate. Just that you have to be checking your blood levels intermittently to know, because if it goes down, we would have to know what to do. It's not every low blood level that we give blood.
Okay.
There's a certain range that we look at.
Okay. All right. Hello. Good morning.
Hello. Good morning.
Yes. How are you?
I'm fine. And you?
Fine. Thank you. Let's hear from you, darling.
Yeah. My question is, I have a child with SC. And, hello?
Yes, I can hear you. Please go ahead.
Yeah. I have a child with SC. And I want to know how serious with that as compared to SS.
Okay.
SC and SS. And then the second question is, somebody told me that I can give the child this drug, forgotten. So I want to know what can I do for such.
Did the person say folic acid?
Getting to crisis.
Okay. All right. Okay. Sure.
Okay.
Doc.
All right. So for SC, like I said, SC and SS, they are both sickle cell disease, but SC as compared to SS is relatively milder. But for the SC, they are more at risk of getting eye problems. So probably you can start an eye check for your child, and also they are also at risk of getting more hip joint pain. So if your child is complaining of all those pains, those are very much peculiar to the SC people, but it doesn't mean it can't also happen in SS. I'm just letting you know about the SC. And then he asked another last question.
In terms of crisis.
Okay, so in terms of crisis, the SS, yes, they will have more severe crisis than the SC, relatively.
Okay, yes, he couldn't remember the many. I have so many messages. I don't have enough time. The calls are coming in.
For the medications, usually they are on folic acid, but for the children up to 5 years, we add a medication called penicillin V.
Penicillin V.
Yes,
okay.
Also to the medication.
Right, so the folic acid and the penicillin
and then now the
V.
hydroxyurea too is also in. So
my phone is still ringing. I think this is the most messages I've received ever since I started on this thing. And too many messages, too many calls coming through. Oh my God, it's still ringing. Okay, let me try and read a message. This one says, I'm Frank from BBN. Can we know the genotype of an unborn baby?
Okay, so it's possible to know the genotype of an unborn baby, but those procedures here in Ghana, we have something called chorionic villus sampling, but here in Ghana, we always wait when the child is born. We have all those options, but as soon as the child is born, now we have the newborn screening. So unless the child is
unfortunately, born. I don't have enough time. I have to go now. I would have loved to read every single message, but I can't. Any number to put out for people who want to contact Sickle Life?
Okay, so for Sickle Life, you can actually contact us on our social media handles. We are on Facebook, IG, Twitter, Sickle Life. Once you just send us a message, they would attend.
Thank you so much for being here. We're super grateful to you at home. Unfortunately, we couldn't bring the whole conversation, but yes, you can call them and they will educate you on it. Her name is Dr. Marian Georgia Kwanzaa, and she's been supporting us. My name is Rosalind Fairley. We'll come back again tomorrow from 6 a.m. to 9 a.m. A very big thank you to the production team. We love you. Enjoy the rest of your day. Bye.